Let's take a look at what a medical coding professional needs to consider when reporting a case of a concussion in the emergency department. First, you will typically see that the patient arrived in an ambulance, as very common in an emergency department situation. However, if the medical coder is working for the emergency department, the hospital itself, you will not usually report ambulance service because the ambulance companies have their own in-house coders. And just FYI, ambulance services are reported with HCPCS level 2 codes. You remember those, right? In that other book. Okay, so let's talk about a concussion. What exactly is a concussion? This is what happens when an external force impacts the head of a human being. Okay, it can cause a headache, as you can imagine, right? Pain at the point of impact in particular. And it can cause the patient to suffer memory loss or confusion. Often, nausea and vomiting are physical symptoms reported. And a loss of consciousness is possible. So we want to be watching for that in the notes. Falls are the most common cause of concussions. And the number 2 reason is contact sports. You may have seen that in the news of late. I don't know. Okay. So this particular patient, when we are looking at the physician documentation for the care of this particular patient who has been diagnosed with a concussion, we must go into the notes and find out, was the patient conscious or unconscious at any point? And if the patient was unconscious, well, how long were they out? Because that's going to be a different code to report how long they were unconscious. So pay attention to that detail. Most probably this is the first time the patient is seen by this physician because it's an emergency department. It's not an ongoing relationship. So most likely your ICD-10-CM 7th character is going to report initial encounter. But as you know, medical coders, we never assume. So make sure you look for, I saw this patient last week, or some kind of follow-up implied in the or written in the doctor's notes. Also, I want to point out, as we just kind of mentioned, severe headache, pain at the point of impact, nausea, vomiting. These are inclusive signs for a concussion. So you remember that what that means, right? They do not get their own codes because that is already included in this diagnosis. So in order to confirm a concussion as the diagnosis, the attending physician needs to do an evaluation, assessment, medical history documented, usually a neurological exam, and then typically that physician will order imaging to be done because it's the only way we can see what's going on inside that skull, right? So MRI, it might be a CT scan depending upon the situation, but in this case we're going to look at doing an MRI. And then an x-ray of the skull. And remember, when we report x-rays, we have to look for how many views, because that may change the code we report. And then x-ray of soft tissue of the neck, which makes sense. If somebody got bonked in the head, you know that can cause like what's known as whiplash, that damage to the soft tissue of the neck. So good for this doctor to check that out. Okay. Also, another thing you want to remember, in cases of trauma, we have an extra job to do. We have to report those external cause codes because we have to know how the patient was hurt and where the patient was hurt. And you'll remember from your learning in class that that's going to affect which third-party payer is going to be responsible for this visit to the emergency room and this whole case of care, okay? And so what you want to look for, and typically it will be in the narrative, in the subjective part of the notes where the patient is going to explain how they came to become hurt. Maybe they fell in their garage, or maybe there was a car accident. So you want to look for those applicable details because you're going to have those extra codes to report. So let's look at a little tiny baby case scenario. Patient fell while looking for something in his garage. He was found unconscious on the floor but regained awareness within a few minutes. Patient complained about a severe headache, pain at the back of his head, and stated he felt nauseous. And the physician documents a 3.5 centimeter scalp wound at that point of impact. Okay, so let's look at a quick coding checklist. For your ICD-10-CM codes, we're looking at the concussion, okay, and we have loss of consciousness. And you'll note that when you look at these codes in this section, it will include concussion with loss of consciousness, without loss of consciousness, and the number of minutes if the patient had lost consciousness. So you need to make sure that you grasp those details from the documentation before identifying which code you're going to report. And while the concussion was the big event of this visit, let's not forget that scalp laceration, because we can't let that patient go home bleeding all over everything. They're just messy, okay? So we have to report the laceration without foreign body and that the physician documented. And then, of course, we have our external cause codes, falling from one level to another, and the place of occurrence, the private home garage. Okay? Now, this is just our example, right? All right, now, our CPT. Remember, the emergency department is always coded as outpatient. Okay? So, evaluation and management, emergency department, we're going to use CPT code 99282, emergency department visit. Very straightforward that the patient had a concussion and then was confirmed. And how did we confirm it? The physician and the facility performed an MRI of the brain, 70551. Good job, without contrast because there was nothing mentioned. X-ray of the skull, 2 views. Now this is, remember, I mentioned before that X-rays, you have to look at how many views because it's going to change the code. In this case, you're going to have 70250 because it was less than 4 views. 2 is less than 4. And you wondered why you had to take math. Okay. X-ray of the neck. Remember, we checked out that soft tissue in the neck to look for damage like whiplash. So that was very good of this physician. And again, let's not forget that scalp lac. We had to repair that wound because that's our job. Well, our job to report it, their job to do it. Okay? 12002, simple repair of a wound of the scalp. And remember also not only the location of the repair by anatomical site, but also the size of the laceration or the wound that is being repaired. All of these details should be in the documentation. Okay, so now you're ready. Let's get into the Chapter 6 cases and practice what you've learned. All cases, physician documentation from actual emergency department visits. If you have any questions, ask your instructor.